Okay, this is a big chapter. We'll try to get through it. It's 179 slides. We'll get through it as quickly as we can. Very important chapter. It tells you why people become addicted and how it happens. Psychoactive drugs are substances that directly affect the central nervous system. The method that a drug gets into the brain are called pharmacokinetics. Literally, it means drug movement. It tells you how it becomes absorbed, how it is distributed throughout the brain or throughout the system, how it is metabolized, and how eventually it is eliminated. Pharmacokinetics have to do with the route of administration. Of course, what she's doing is cooking opium, and she's sucking it up through the straw. Speed of transit to the brain, how fast does it get from wherever it starts to wherever it's going? Affinity for nerve cells and neurotransmitters, different chemicals, different drugs affect the brain differently. When a psychoactive drug can get it to its target in the central nervous system rapidly, the more addictive it tends to be. Inhaling, when a person smokes a psychoactive substance or draws it in as a vapor, as with nitrous oxide, or inhaling an active chemical solvent, colloquially referred to as huffing, the drug enters the individual's lungs. The drug is rapidly absorbed through the capillary lining of the alveoli of the bronchi. The psychoactive substance travels through the body with the blood and is pumped to the brain in the tissues of the body and may reach the brain in as short as 7 to 10 seconds. Inhaling is the most rapid method of getting a psychoactive substance into the system. This is one of the reasons why it's so popular. Whoops, wrong direction. Individuals are able to control levels and reactions of the psychoactive substance, known as titration, by regulating the frequency of use and the depth of inhalation. This is why most tobacco smokers spend more time holding their cigarettes than actually puffing them. Since smoking is an inefficient means of administering the psychoactive properties of marijuana, THC is the substance that is the hallucinogen. 60% of the substance is lost. Pharmaceutical companies are working on aerosol and nasal sprays to deliver the THC, and those are Marinol and Dronabinol are the two aerosols and nasal sprays. This method would also eliminate the tars and other toxic substances that make marijuana carcinogenic, and of course that is a really serious problem with marijuana. Injecting is where the individual introduces the psychoactive substance into the body by using a hypodermic needle and a syringe. There are 3 methods of injecting appropriate psychoactive substances into your body. Intravenous, into the vein, colloquially known as slamming, is where the psychoactive substance is injected directly into the bloodstream. This method delivers a psychoactive substance through the bloodstream into the brain in 15 to 30 seconds. This method is the most likely to create a head rush, an intense feeling of excitation, and mental electricity. Intramuscular, into the muscle, colloquially referred to as muscling. The psychoactive substance is injected directly into the muscle. This method of introducing psychoactive substances through the bloodstream and into the brain in 3 to 5 minutes. This method will not create a head rush, but a slower buildup of euphoria. Subcutaneous, under the skin, colloquially referred to as skin popping. The psychoactive substance is injected directly under the skin. This method of introducing psychoactive substances through the bloodstream and into the brain in 3 to 5 minutes. This method will not create a head rush, but a slower buildup of euphoria, and as you can see, it causes all kinds of interesting circular scars on the individual. And there is somebody that's a skin popper. I had a friend when I was working at Fort Belknap who was a skin popper, or he had been a skin popper, and he had these strange circular scars on his arms. This man's not dead, by the way. He's just mocked up to look like he's dead. Injection is the most dangerous method of introducing drugs into the body because once they are entered, there is no turning back. Injecting also introduces the user to a whole host of contaminating infections such as hepatitis B and C, syphilis, and HIV. The individual is also more prone to abscesses and embolisms. Embolisms are blood, it's another name for blood clots. Mucous membrane absorption, select psychoactive substances that come in a powdered form can be inhaled through the nose and absorbed in the capillaries found in the mucous membrane. This is, you can do this with cocaine, you can do it with heroin, methamphetamine, and ground OxyContin. This is sublingual. This method is much more rapid than oral ingestion. It bypasses most of the body's defenses, such as your digestive acids, your enzymes, and the liver. Besides snorting through the nose, there are two other methods used: buccally between the gums and cheek, like snuff, or sublingually under the tongue. And this is how you introduce nitroglycerin for somebody who is somebody's having a heart attack. It takes the pain away from the heart attack. What did I want to say about that? Oh, okay. Anyway, nitroglycerin for heart attacks. If you just give them the nitroglycerin to swallow, the stomach acid, the stomach juices will destroy it, so it doesn't do anything. So you have to put it under the tongue. Absorbing drugs through the mucous membrane in the rectum and the vagina are also possible. This is usually administered as a suppository, but can also be used for recreational drugs such as ketamine and cocaine. We won't tell you. Well, this is an actual X-ray of a guy that stuck one of these things up his rectum. That's an aerosol can. Women have been known to soak tampons in alcohol and then put them into their vaginas, and of course they got drunk fairly quickly. Oral ingestion: when a drug is swallowed, it goes through the esophagus into the stomach, passes into the small intestine where it is absorbed by the capillaries and the mucosal lining of the intestine. This method requires between 20 and 30 minutes before the drug begins to affecting your brain. And this is one of the reasons why when you take an aspirin or Tylenol or an Advil, and then your headache goes away right away. The pill is probably acting as a placebo because it should take about 20 to 30 minutes for that drug to start working. If the psychoactive substance is a beer or other alcoholic beverage, about 10 to 20% of the substance will be metabolized by the stomach. It's really hard to say because everybody's different, and your fat content, whether you're a male or a female, all of these have something to do with how rapidly the alcohol gets into your system. Males tend to metabolize alcohol faster than women, and thus get drunk slower than a woman who consumes the same amount of liquor. And this is a hint and a warning to women: don't ever match shots with men because your body is not put together to handle the alcohol like theirs is. Most psychoactive substances are fat soluble and so move readily across membranes. Alcohol is both fat and water soluble. Transdermal absorption: drugs are now being impregnated on adhesive patches so that the medication can be slowly absorbed through the skin. Some of these patches provide medication for up to 7 days, though it may take as long as 2 days before a therapeutic level of the drug makes it into the system. Because of various factors, psychoactive substances in the blood do not remain in the system for the same length of time. This is known as bioavailability. There are various factors that restrict the availability of the psychoactive substance to the target tissue after administration. Once a psychoactive substance enters the bloodstream, it can be transported inside the blood cells in the plasma by attaching itself to a protein molecule. All depends on the drug as to how it's transported. The psychoactive substance will visit every organ in the body where it will either cause and effect, it will be ignored, it will be stored usually in fat cells, it will be biotransformed, broken down into chemical variations that may or may not increase the psychoactive effects. While the chemical structure of the drug is a factor in distribution, so is the size of the individual. A lighter person with less blood volume will have less blood to dilute the chemical. The blood volume of an adult is 6 to 8 quarts of blood. For children, it may have 3 to 4 quarts. And this is one of the reasons why they're saying that marijuana edibles are dangerous for children. The children are eating them. I guess they're thinking they're candy, or maybe they understand that they are taking in a psychoactive substance. But of course, that much THC in an edible can do a lot of harm to the child because, well, it's because they have half the blood that an adult has, and because of that, the dilution factor is different, and so the edible is 2, 3, 4 times as strong. Organs with extensive vascularization will be affected by a drug to a greater degree. This is one of the reasons why cocaine can cause fatal heart reactions. To much of the drug affects the highly vascularized heart, causing arrest, and that is the problem with cocaine. It can kill you, even if you've used cocaine for an extended length of time. A pure dosage of cocaine can cause it's a vasoconstrictor, and it causes constriction of the heart. And of course, as long as this is just momentary, usually you just have a little bit of a flutter, but it can shut your heart down for good, and that's one of the reasons why people die of overdoses of cocaine. Humans would have died from bacteria, viruses, and toxins at the beginning of our evolution if it weren't for our ability to keep most of these substances out of our central nervous system. The walls of the capillaries that feed the nervous system consist of tightly sealed epithelial cells that only allow certain substances to penetrate. This is known as the blood-brain barrier. Luckily for those who need a chemical assistance in their lucidity, psychotropic medications do not cross the blood-brain barrier and change serotonin, GABA, etc. to reduce the symptoms of depression, anxiety, or whatever. The chemicals that people use as psychoactive substances also will cross the blood-brain barrier. Otherwise, they wouldn't be taken since there wouldn't be a brain reaction to them. This is another picture of Amy Winehouse. When I first put this together, she had just died of alcohol poisoning, but she was a notorious user of drugs. For some reason, and we're going to talk about this. Tom Petty, Prince, Elvis Presley, a lot of musicians tend to mix their drugs. Jimi Hendrix, and unfortunately, of course, and comedians are John Belushi, Chris Farley. Anyway, yeah, she was a famous individual that died way too young from a drug overdose, or from alcohol overdose in this case. The reason psychoactive substances cross the blood-brain barrier is because the brain is very fatty, and most psychoactive substances are fat-soluble or lipophilic, especially nicotine, alcohol, and marijuana. And this is how long it takes to detect it in your urine, or how long it will be detected in your urine. You take something into your system. Sometimes if it's fat, especially if it's fat soluble, it'll stay in your system and be detectable for an extended length of time. Amphetamines, as you can see, 2 to 4 days. Barbiturates, 4 to 7 days. Benzodiazepines, 3 to 7 days. Cocaine, 2 to 4 days. Ecstasy, 1 to 3 days. Methadone, 3 to 5 days. And this is one of the reasons if you get arrested for drunk driving and they take a drug urine test, this is one of the reasons why if you were actually using or had used in the last week, you're pretty much out of luck here. Methamphetamine, 3 to 5 days. Opiates, 2 to 4 days. Opiates, 2 to 4 days. Phencyclidine or PCP, 7 to 14 days. THC, 15 to 30 days. And that's something that you need to remember if you ever have to take a drug test. TCA, tricyclic, that's an antidepressant, 7 to 10 days. Propoxyphene, 1 to 2 days. Oxycodone, 2 to 4 days. Amphetamine, 2 to 4 days. Cocaine, 2 to 4 days. And methamphetamine, 3 to 5 days. Anyway, yeah. So it can be detected in your saliva 6 to 12 hours with THC. Drugs that are completely fat soluble will cross the blood-brain barrier very rapidly. Drugs that are only partially fat soluble will cross the barrier much slower. This is the case with morphine, which crosses the barrier much slower than heroin. This form of crossing the barrier is known as passive transport. In order for the morphine to cross the blood into the blood, it has to attach itself to a protein, and so that whole process takes a little bit more time. Active transportation takes place when a water-soluble hydrophilic chemical needs to cross the blood-brain barrier. A water-soluble chemical must first attach itself to a chemical structure that will readily cross the barrier. In the case of cocaine, cocaine hydrochloride attaches itself to a protein molecule. Most water-soluble substances, such as antibiotics, will not cross the barrier. The blood-brain barrier does not completely develop until the individual is 1 or 2 years old. Toxic chemicals that will not injure adults cross an infant's barrier and cause brain damage. The placental barrier protects the developing fetus from water-soluble chemicals, but since most psychoactive substances are fat-soluble, the fetus uses what the mother uses. And that is something to remember. The body is always trying to rid itself of foreign substances, whether they are harmful or helpful. It does this in 2 different ways. One is metabolism, processing, using, and inactivating a substance. Most of this takes place in the liver, and excretion, expelling the foreign substance and its metabolites from the body. This takes place mostly in the kidneys. So if you're a user of psychoactive substances, even marijuana or alcohol, all of these have to be excreted by your kidneys and metabolized by your liver. And this is one of the reasons why alcoholics have problems with their liver. It's also the reason why they tend to have kidney problems, because they are poisoning their kidneys and their livers with alcohol. And it's actually pickling their liver, what they refer to as pickling their liver and destroying their kidneys. So you see a lot of people that were alcoholics who are on dialysis because they've destroyed their kidneys. When the liver metabolizes alcohol, it breaks it down into water and carbon dioxide and excretes it from the body through the urinary tract, sweat, and as vapor from the lungs. It's really kind of amazing. I worked in the emergency room for an extended length of time. A lot of people that came in, I lived in, not exclusively, I lived in Omaha for 10 years. I worked in the emergency rooms in Omaha. A lot of drinking being done in Omaha. And I'll tell you what, when somebody comes in who's been drinking, you can certainly smell it on their breath. You can smell it on their sweat, as odd as that is. I had a friend who was I was a lab tech. But this individual was the individual that ran all the blood alcohol tests at a certain hospital in Omaha. And she could smell somebody's sweat and tell exactly what their alcohol level was. And of course, she'd had a lot of experience because she's the one that ran the blood alcohol test, so she knew how much was coming off of this individual. She knew how much she could smell, and she was the one that actually got the figure. She was the one that ran the blood alcohol on the individual. So she learned how to detect alcohol levels from sweat and from breath. This is Lindsay Lohan, who had a promising career in films and ruined it with her drinking. The liver breaks Valium into 4 metabolites that are actually active in themselves and affect the brain. The measurement of the metabolism or elimination of a chemical is the half-life. It takes 6 half-lives to break a chemical down so that it isn't detectable. Cocaine's half-life is 30 to 60 minutes, so it's detectable in your blood for 3 to 6 hours. Methadone its half-life is 15 to 60 hours. It's detectable for up to 15 days. THC's half-life is 20 to 30 hours. It's detectable for 5 to 7.5 days, which is, yeah, I guess it is right. Prozac, 1 to 6 days, detectable for 6 to 36 days. Clearing the system is based on many factors, so none of these figures are absolutes. Really all depends on who you are, where you are, and your age. Age is a factor in the metabolism of drugs. After the age of 30, the liver begins producing fewer and fewer enzymes to metabolize select chemicals, such as alcohol and the sedative hypnotic drugs. This is not only true of psychoactive substances, it's also true of spices and chemicals that you might cook with. So an individual who used to eat really hot chili when they were 10 or 20, when they were 20 or 30 years old, by the time they're 40 or 50 years old, all of a sudden their stomach can't handle it anymore. That's the way my stomach is with garlic. What else? Once upon a time, I used to eat a lot of garlicky food, but I can't do it anymore. It just burns my stomach. And that's because all of these things change with time. Race has been shown to be a factor in levels and types of enzymes maintained in the liver. Caucasians tend to maintain enzymes used to metabolize alcohol rapidly, while Asians metabolize alcohol slower and with more side effects, quicker drunkenness, and a rapid flushing of the face. And if you've ever been around somebody from China or Japan and gone out drinking with them, you will know that they probably flushed, their face became flushed fairly rapidly, and they got drunk a lot faster. Hereditary factors can affect metabolism. Some people inherit fewer enzymes. Some people inherit more body fat to store drugs. Some people inherit a high metabolic rate to help eliminate drugs. Health can affect metabolism. Unhealthy people tend to metabolize chemicals slower or less completely. For example, the individual may have severe liver damage due to hepatitis or cirrhosis. Anytime you have the flu, anytime you're sick, your ability to clear this stuff out of your system is depleted. An individual's emotional state changes the effects of a drug. Anger or anxiety in a person using methamphetamines may cause episodes of lashing out or violence. The presence of other drugs will delay the metabolism of select drugs. When alcohol is used with Xanax, a Xanax will stay in the body 2 or 3 times longer than normal. This delay of metabolism and exaggeration of effects is called drugs synergism. Not everyone's body chemistry is the same. This is why some people are allergic to select drugs and others aren't. Some people lack the enzyme that metabolizes cocaine, so even a small amount in the system will result in an exaggerated reaction and even death. I am not sensitive to opiates or opioids. I can take them all day and they don't affect me at all, which is kind of scary because when I have surgery and they have to knock me out, it takes 2 or 3 times as much as they would use on anybody else. And I have awakened during surgery, which is not a lot of fun. Other factors that can affect the metabolism of a psychoactive drug: your weight, your level of tolerance, your monthly hormonal cycle if you're a woman, enzyme induction, enzyme inhibition, and weather. Right now in Iowa, we're having a storm is blowing through, and it changes the barometric pressure. It forces things into your system faster. So if I were drinking alcohol right now, I would probably get drunk faster than if it were a sunny day. In order to understand the effects of psychoactive substances have on the nervous system in general and the central nervous system in particular, we need to review the various nervous systems that control our bodies. The weather really affects your body a lot. For example, if you urinate more when it's cloudy and stormy outside, that makes sense because the barometric pressure, as I said, it's pushing. The barometric pressure is greater, so it's pushing things into your system little bit faster. So a lot of people will urinate. I do, I know. When if it's a stormy night, I'll get up 2 or 3 times during the night to urinate. And if it's not, I don't. I don't get up at all. So the nervous system can be divided into 2 basic parts. The central nervous system, which consists of the brain and the spinal column and controls most nervous responses. The peripheral nervous system, which encompasses all other nerves outside the central nervous system and communicates impulses to the central nervous system. The peripheral nervous system collects information, sends it to the central nervous system, which then responds to the stimulus back through the peripheral nervous system. The proper response will be through the appropriate system of the body, the nervous system, the skeletal system, the endocrine system, the digestive system, the respiratory system, the muscular system, circulatory system, urinary system, lymphatic system, and integumentary system, which is your skin. Psychoactive drugs may alter information headed for the brain. Painkillers block the chemicals that tell the brain that they are in pain. Psychoactive drugs can disrupt messages sent back to the parts of the body when someone is so drunk that their hands and feet don't work properly. Psychoactive drugs can disrupt thinking. Alcohol again. Psychoactive drugs may affect an organ when they pass through it or affect them when the central nervous system sends back a distorted message. Evolutionary psychologists speculate that any changes to the human form, including the brain, continued because they assisted the individual in their survival. A good example of this is the human affinity for sugar and fat, which provides a quick and more prolonged energy source. Another example would be the affinity for sexual intercourse for both males and females, which led to offspring which guaranteed the survival of the species. Following the evolutionary premise, psychoactive substances must serve some purpose. One reason may be that most psychoactive substances affect our natural survival mechanisms, but initially cause desirable effects. Eventually, as humans, we may adapt to the effects of these substances, but as for now, these substances are subverting our survival mechanisms, and in many cases, the result is anti-survival. The human brain not only maintains the largest cerebrum, the new brain, of all creatures, but all the structures of the lower animals, the old brain. As survival became more complex, higher animal forms developed new brain structures to aid them with survival. The primitive primal or old brain consists of brainstem, cerebellum, midbrain, mesocortex, the limbic system. These brain structures can be found from animals as primitive as fish to humans. The old brain regulates physiological functions. Respiration is controlled by your brainstem, heartbeat by your brainstem again, body temperature by your brainstem again, hormone release by your hypothalamus and pituitary glands, and movement by your cerebellum. And this, of course, is your cerebellum right here, and that's your cerebrum. Everything else, all this stuff on the inside of your brain, that's your primitive brain. The old brain, the limbic system, is the area that acknowledges the experience of basic emotions and craving. Fear, anger, hunger, thirst, lust, pain, and pleasure come out of this section right here. The old brain is the area that imprints survival memories, specifically the limbic system. Most psychoactive substances act on the old brain, causing euphoria in this area and thus providing the euphoric memories that lead to addiction. The emotions of the old brain overpower the reasoning capacity of the cerebrum and lead to the repeated taking of euphoric substances. As hominids advanced over time, more and more brain power was needed to survive. This came to us in the form of the cerebrum and the highly convoluted neocortex. The new brain aids us in solving problems of survival, and that's why we are so successful at it. Most of the time, the new brain controls the old brain. Reasoning trumps emotion. However, when a person uses psychoactive substances, the craving from the old brain may override rational arguments. Too expensive, too bad side effects, dangerous. I have other responsibilities that are more important than my pleasure. And of course, this is hopefully what your new brain is telling your old brain. The reward reinforcement pathway encourages a human to perform or repeat an action that promotes survival. It is this pathway that is affected by psychoactive substances. Also referred to as a mesolimbic dopaminergic reward pathway, it has a stop switch, the orbital frontal cortex, and a more switch. The more area is also known as the pleasure center and encompasses four structures: the amygdala, the lateral hypothalamus, the nucleus accumbens septi, and the ventral tegmental area. The pleasure center serves two purposes. It gives a feeling of satisfaction when a need is fulfilled, or even the anticipation that a need will be fulfilled. It gives a surge of relief or intense satisfaction when a pain is diminished. I told you the weather's bad here, and that may be what's causing my congestion. Psychoactive substances activate the pleasure circuit and rewards the individual with a feeling of satisfaction or pain relief. Unfortunately, psychoactive substances overactivate the pleasure center and shut down the stop switch, enabling the individual to feel an intense need to continue use. And this is one of the reasons why people get drunk and why people do such stupid things when they're drinking. The reasoning portion of your brain is anesthetized, and the pleasure center of your brain is still being activated. And for that reason, people do things that they wouldn't do when they were sober. 3 phases of brain activity with the reward reinforcement pathway. Number 1, the anticipation of drug use or compulsive behavior creates craving. Internal or external cues activates the amygdala, which causes a release of dopamine from the ventral tegmental area, which in turn activates the nucleus accumbens, causing craving. For an alcoholic passing a bar, which is an external cue, it would activate the amygdala, causing a release of dopamine from the ventral tegmental area, which would activate the nucleus accumbens, causing a craving for alcohol. For someone who smoked pot with their friends before they went away to school, when they see their friends on spring break, it's an external cue, it would activate the amygdala, causing a release of dopamine from the ventral tegmental area, which would activate the nucleus accumbens, causing a craving for pot. The second phase of the reward reinforcement pathway involves the brain telling the individual to do it again after ingesting the psychoactive substance. With use, dopamine is released from the ventral tegmental area, which activates the nucleus accumbens to continue the craving. Let me take a quick drink here. Phase 3 of the reward reinforcement pathway involves the nucleus accumbens signaling the orbitofrontal cortex that has taken in the substance and asks for a signal of more or satiation. In addicts and abusers, this signal is weakened, as is the reasoning function of the area, resulting in ingestion that does not lead to satisfaction. Psychoactive substances imprint the memory of euphoria or pain relief more deeply than most natural survival memories. The alteration of brain chemistry causes normal activities to be less pleasurable. To a methamphetamine addict, the desire for the drug will be more important than her relationship with her children, and she will actually prostitute them out in order to get another fix. To the compulsive gambler, gambling will become more important to them than food or sex. Psychoactive substances tend to affect the physiological functioning of the body, especially heart rate and respiration. It is the effect on respiration that causes most drug overdose emergencies and, of course, death. Psychedelics, LSD, marijuana, and the rave drugs not only affect the old brain, but the new brain as well. These drugs especially affect memory as they activate two areas of the brain that help to control memories, the amygdala and the hippocampus. As people age from childhood to adolescence to adulthood, they learn to integrate the drives of the old brain with the reasoning and common sense of the new brain. Developmental problems, childhood traumas such as chaotic or abusive childhoods, compulsive behavior, or psychoactive drug use can circumvent survival mechanisms and lead to irrational behavior or addiction. The most important structure of the reward reinforcement pathway is the nucleus accumbens septi. This bundle of nerves is the most powerful reinforcer in the pathway. It is this area of the brain that drives people to action. Research with rats stimulating the area of the brain led to death. They could do nothing else but stimulate this area. Human subjects who stimulated the same area behaved in a similar manner to the rats, but of course they didn't let them stimulate themselves to death. Social factors tend to affect the obsession to use a psychoactive substance. The psychoactive substance alters the brain chemistry to make the individual want to use. This is one reason why only complete abstinence will stop the craving. To begin again will lead to the craving starting at the same intense level. That's one of the things that happened with Robin Williams. Robin Williams was a cocaine user. Just before he committed suicide, he fell off the wagon. He went back to rehab. When he came out of rehab, it wasn't very long after that he committed suicide. Brain imaging has shown that brain cells change as addiction develops. While normal memory doesn't take place until an action has been repeated 3 or more times, intense stimulation can cause sensitization with just one encounter. These neural pathways are highly sensitive and may cause relapse in just one additional encounter. And this is one of the problems with just having one drink or smoking one joint or whatever. Why do psychoactive drugs disrupt on or off switches of the reward reinforcement pathway? One theory is that since they don't originate from any essential body need, the brain has no satiation point established for psychoactive substances. A second theory is that the on-off switch gets stuck on the on position. The person doesn't realize that the act has been completed. The person will use until they run out of drug or pass out. A third theory is that the psychoactive drug creates such euphoria or pain relief that the on-off switch is ignored or overridden by the brain. A fourth theory is that the psychoactive substance disrupts communication between the old and the new brains. Many psychoactive substances incapacitate the thinking and reasoning portion of the new brain, and the individual reverts to old brain instincts or automatic functioning. I don't know how he got down there. How did he do that? The main instrument of the nervous system is the neuron. The neuron is composed of the soma, axon, and the dendrites. The soma, the axon, and the dendrites. These are also dendrites. That's the soma, that's the axon. And these are the terminals, but they are also dendrites. Each neuron may make contact with one entity up to 150,000 entities. It is estimated that there is between 100 trillion to 500 trillion neuronal connections in the human body. Neurons are different lengths from fractions of millimeters to the sciatic nerve that can be a meter long and runs from the heel to the spinal column. All depends on how tall you are, of course, how long your legs are. Neurons do not touch, but they do communicate with one another. This communication takes place in the synaptic cleft, a gap between the two neurons. In order for the two neurons to communicate, a chemical messenger called a neurotransmitter must pass between them. The operant word here is chemical because the messenger is a chemical. When we talk about dopamine, acetylcholine, serotonin, GABA, they're chemicals. The neurotransmitter is housed in tiny sacs called vesicles. Acetylcholine, the neurotransmitter that is the neurotransmitter that activates the muscles. It works as a vasodilator. It controls mental acuity, memory, and learning. It decreases with age, causing rapid dementia referred to as Alzheimer's disease, or it can decrease with age. It was the first neurotransmitter that was discovered. Norepinephrine and epinephrine were the second neurotransmitters discovered. In the beginning, they thought it was the same chemical, but of course it's not. Sorry, I need to close the door. They act as stimulants when the body demands energy. They control hunger, attention span, motivation, confidence, and alertness. Epinephrine gives you energy. Norepinephrine gives you confidence and feelings of well-being. Wait a second. Let me make sure nobody's here. Oh, nobody is here. Dopamine. Sorry. Dopamine regulates fine motor muscular activity, emotional stability, satiation, and the reward reinforcement pathway. Dopamine is the most important neurotransmitter involved in drug abuse. A reduced amount of dopamine leads to Parkinson's disease. Excess dopamine causes schizophrenia. And this is a picture painted of a cat by an individual who was schizophrenic and was going into a psychotic episode. As you can see, the cat looks like a cat in the beginning, and then it gets more and more bizarre. Histamine controls the inflammation of tissues and allergic reactions. It regulates emotional behavior and sleep. This is one of the reasons why if you have a cold, you can take an antihistamine and the inflammation in your mucous membrane in your nose will go away. Or if you have any kind of allergic reaction, usually you can take an antihistamine and the inflammation will be decreased. Serotonin controls mood stability, depression, appetite, sleep, sexual activity. Mood can be elevated by forcing more serotonin into the synaptic clefts. Enkephalins, endorphins, and dynorphins are involved in regulation of pain, relief of stress, immune response, stomach activity, and other physiological functions. The reason I have the runner up here is because it is endorphins or enkephalins or dynorphins, one of the three, that causes runner's high. Gamma-aminobutyric acid, GABA, is the main inhibitory neurotransmitter. It's involved in 25 to 40% of all the synapses in the brain. It controls impulses, muscle relaxation, and arousal. It slows down the brain. Alcohol has a strong effect on GABA. Glycine is an inhibitory neurotransmitter. It's found in the brainstem and spinal cord. It slows down the brain. It's prominent in protein synthesis. Glutamic acid, glutamate, or glutamine are important excitatory neurotransmitters. It plays a major role in cognition, motor function, sensory function, reinforces your memory. It is a precursor for GABA. Substance P, the P stands for peptide, not pain, conveys the pain message to the brain from the peripheral nervous system. Enkephalins block substance P, and that is the reason that your body can control pain if you have enough enkephalins. Anandamide has an affinity for the receptor sites that accommodate THC, and we can reverse that because THC, of course, isn't the natural substance. It's anandamide in your system, so the anandamide is the receptor site for the THC. For the longest time, we had no idea what was going on. We couldn't figure out why people reacted to THC. We knew that it attached itself to something in the brain, but we weren't exactly sure what. And then we discovered anandamide. The anandamide is found in the limbic system, integration of sensory experiences with emotion, and this is one of the reasons why people become emotional when they smoke pot. It controls learning, motor coordination, and memory, and this is one of the reasons why when you're stoned, your short-term memory is disrupted, and you can't learn anything. It acts as an analgesic, and this is one of the reasons why people want to use marijuana medicinally, because it takes away the pain. Corticotropin, ACTH, and cortisone aid the immune system. It helps healing. It is part of the stress control. Nitric oxide, since it was discovered in 1992, the functions of nitric oxide just continues to expand. It is necessary for the erectile function of the penis, and this is the reason why this is how they developed Viagra and Cialis and what's the other one? Levitra. It helps regulate emotions. In too large dosages, it can cause cancer and vascular collapse. Not a good combination. Alcohol directly affects GABA, metenkephalin, and serotonin. Benzodiazepines directly affect GABA and glycine. Marijuana affects anandamide, arachidonyl glycerol, 2-AG, acetylcholine, and dynorphin. Heroin affects endorphin, enkephalin, and dopamine. The dopamine makes you happy, and these two take the pain away. LSD affects acetylcholine, dopamine, and serotonin. Nicotine affects epinephrine, endorphin, and acetylcholine. Cocaine and amphetamines, dopamine, epinephrine, norepinephrine, serotonin, and acetylcholine. MDA and MDMA, the ecstasy drugs, affect serotonin, dopamine, epinephrine, and norepinephrine. PCP affects dopamine, acetylcholine, and alpha-endopsychosin. Neurotransmitters attach themselves to receptor cells on the receiving entity, muscles, organs, or other neurons that are chemically structured to only accept that neurotransmitter. However, select receptor sites may have different functions for the same neurotransmitter. There are 7 types of serotonin receptors, each of which has a slightly different function. Dopamine has 5 types of receptors referred to as D1 through D5. The D2 receptor is a site that is used by most psychoactive substances. D2 site, yeah. Each neuron maintains and transmits only one type of neurotransmitter, except for neurons that transmit epinephrine, which may also transmit norepinephrine. However, a neuron may have receptor sites for any number of neurotransmitters. A neuron is stimulated when it receives enough neurotransmitter to create a chemical imbalance in the neuron that forces sodium and potassium gates to open. The increase of positively charged sodium and potassium ions from outside the neuron and the flooding out of negatively charged chloride ions causes an electrical chain reaction to run down the neuron to the axon terminal. At the axon terminal, the electrical stimulation causes the vesicles to release their neurotransmitter into the synaptic cleft, which in turn stimulates a partner neuron. Excitatory neurotransmitters work by opening sodium gates, allowing sodium into the neuron. Inhibitory neurotransmitters work by opening chloride gates, making the neuron more negative and thus more difficult to stimulate. The stimulation of the neuron by the neurotransmitter is known as the first messenger system. If the neuron is stimulated by another entity, such as a biological or chemical change, it is known as a secondary messenger system. The neurotransmitter can't remain in the synaptic cleft, or the reaction won't stop, so it must be removed. The neurotransmitter, this occurs in one of 2 ways. The neurotransmitter is chemically broken down. Acetylcholine breaks down to acetylcholinesterase. Is broken down by acetylcholinesterase. Anytime it has an ASE at the end, it is an enzyme. The neurotransmitter is taken back by the neuron that originally distributed it in a process known as reuptake. The number of receptor sites is not constant. When the amount of neurotransmitter decreases, the cell will increase the number of receptors so that as each neurotransmitter as possible finds a place to attach, and this is known as upregulation. So when a neurotransmitter decreases, we actually have an increase of receptor sites. If there is too much neurotransmitter in the synaptic cleft, the number of receptor sites will decrease to prevent overstimulation, and this is known as downregulation. So if there's too much of the chemical in there, it's causing too great a stimulation. The number of receptor sites will be reduced. This occurs when someone takes drugs. The individual takes more and more of the drug, trying to achieve the same reaction as they had originally. Excessive use of the drug may cause a permanent downregulation, or it can cause the death of the neuron. Psychoactive drugs work because they act as either agonists or antagonists. Agonists either mimic or facilitate the effects of a neurotransmitter. Nicotine, ethanol, LSD, and THC, if this happens partially, it is known as partial agonists. Antagonists block neurotransmitters. If the receptor is stabilized, making it inactive by a drug, the drug is referred to as an inverse agonist. How drugs affect neurotransmitters? They can block the release of neurotransmitters. Heroin blocks the release of substance P. They can force the release of neurotransmitters, forcing more to be released than is released naturally. Cocaine forces the release of norepinephrine and dopamine. Ecstasy, MDMA, forces the release of serotonin. How drugs affect neurotransmitters? The drugs can prevent the reabsorption of the neurotransmitter. SSRIs block the reuptake of serotonin, elevating the person's mood. The drugs can inhibit an enzyme that helps synthesize the neurotransmitter. Blood pressure medicines inhibit enzymes that allow the production of norepinephrine, which would cause high blood pressure if allowed to be released in the synaptic cleft. How drugs affect neurotransmitters? Drugs can inhibit enzymes that break down neurotransmitters in the synaptic cleft, allowing the neurotransmitter to remain in the cleft. Methamphetamine inhibits monoamine oxidase and catechol-O-methyltransferase, which break down norepinephrine and epinephrine in the synaptic cleft, allowing there to be more epinephrine and norepinephrine. If you remember, norepinephrine makes you feel good. It makes you feel, it gives you a feeling of well-being, and epinephrine gives you energy. So methamphetamine makes you feel good, makes you feel on top of the world, and it gives you more energy. The drug can interfere with the storage of the neurotransmitter. The drug can do a combination of any of these interactions, causing a control. While some drugs have desired effects like making the individual resist fatigue or block pain, they can also be dangerous. Cocaine forces the release of norepinephrine and dopamine, which makes the individual not only stay up beyond normal exhaustion, but respond in an overly excited and sometimes violent manner. Heroin blocks pain and creates a euphoric sensation by attaching to receptor sites in the reward reinforcement pathway, but unfortunately also attaches to the breathing center, depressing respiration. And if you take too much, it will kill you. It will shut down the breathing center and you will die. LSD acts as both a stimulatory neurotransmitter and alters the user's perception of external messages, mixing their perceptions so that they may hear images and see sounds. And this is known as synesthesia. Other psychedelics block the action of acetylcholine, creating hallucinations. The body may deal with drugs in several ways. It may develop tolerance, may develop tissue dependence, may develop psychological dependence. You may go through withdrawals, or it may break down the drug completely in metabolism. That's what happens to me with opiates and opioids. My body just breaks it down. It doesn't have any effect on me at all. Any foreign substance will be treated as a toxin in the body. The liver and the kidneys will try to eliminate it so that it cannot do any damage. If the individual continues to use the substance, the body will adapt to having the drug present. This adaptation to the presence of a toxin is called tolerance. Tolerance to drugs will force the individual to take more and more of the drug to get the same effect. A methamphetamine user will achieve a certain level of euphoria and energy the first time that they use it. If they use every day for 100 days, by the 100th day, they will have built up a tolerance for the drug that will necessitate a 20 times increase on the amount that they used the first time. In order for tolerance to occur, sometimes the drug must be taken irresponsibly. If the individual is taking Valium at higher doses than the doctor prescribes, or the doctor is prescribing heavy usage of the medication, the tolerance will be accelerated. Research shows that there are individuals who have built up a tolerance to the degree that were using 100 to 200 times the standard dosage. Tolerance will return to normal if the drug is no longer used. Types of tolerance: dispositional tolerance. The body accelerates the metabolism of the drug by producing more of the enzyme used used to metabolize the toxic substance. The more people drink alcohol, the greater their tolerance because of dispositional tolerance. Thus, the individual will have to consume high levels of alcohol to become intoxicated. Pharmacodynamic tolerance: affected nerve cells become less sensitive to the drug. When opioids are used, neurons begin generating fewer receptor cells to the opioid to lessen its effects. The body will also produce cholecystokinin as an antagonist to the drug. Cholecystokinin comes out of your gallbladder. Kinds of behavioral tolerance. The brain compensates for the effects of the drug by using parts of the brain not affected. A person who is drunk can force themselves to appear sober when necessary. Reverse tolerance: as the drug destroys tissue, the user becomes more sensitive to the drug and can tolerate less and less of the substance. This happens to alcoholics who suffer from cirrhosis of the liver. Since the liver doesn't work as well, a little alcohol will get them drunk, because the liver is not operational enough to metabolize the alcohol. Acute tolerance or tachyphylaxis. The brain and the body adapt instantly to the toxic effects of the drugs. Tolerance to tobacco occurs this way. People who try to commit suicide using barbiturates may experience the same instant tolerance and survive twice the legal dosage. LSD will not work if 2 doses are taken close together due to tachyphylaxis. That's one of the reasons why LSD is such a small. You get an effect from a small amount. If you take a larger amount, you won't get a stronger effect. Select tolerance: the body develops tolerance to mental and physical effects at different rates. This occurs with opiates and sedatives. With barbiturates, sleep will be induced long after the euphoric effect is no longer present. Inverse tolerance or kindling: the brain chemistry changes so that the person becomes more sensitive to the effects of the drug. With continued use, cocaine and marijuana users will get a minimal effect, and then after months will start to get an intense reaction. In the case of cocaine, it might cause heart attack or stroke. Cross tolerance: if a person develops a tolerance for one drug in a family of drugs, they will be tolerant to other drugs in that family. The opioid family is this way. Tolerance to heroin will make a person equally tolerant of morphine, codeine, or methadone. A person tolerant of Xanax will be tolerant to other benzodiazepines and even the depressant alcohol. A person tolerant to barbiturates will be tolerant to benzodiazepines. Tissue dependence: this is the biological change of the body to adapt to the presence of the drug. This usually occurs after prolonged use. Allostasis sometimes will occur where the tissues and the organs of the body depend on the drug to be functional. In these circumstances, cessation of the drug usage will cause dangerous and dramatic withdrawals. In select circumstances, cross-dependence will occur when dependence of one drug can be alleviated with another drug. Psychological dependence: addiction used to mean that the person taking the drug was tissue dependent on the drug, but with continued research in brain imaging technology, it has been recognized that psychological dependence is an important factor in addictive behavior. The altered states of consciousness that are caused by select drugs can lead to continued misuse and avoid life's problems. Psychological dependence: it is now acknowledged that psychological dependence occurs before tissue dependence and that the response rate from either is similar. Psychological factors that induce reinforcement: drug automatism. Individual uses the drug aimlessly, unconsciously, and repetitively. Negative reinforcement and pleasant states encourage drug usage. Smokers will wake up in the middle of the night to smoke to dissipate nicotine withdrawal. Social reinforcement, peer pressure, and the need for social inclusion encourages continued use. Opioid effects, numbness, euphoria, dryness of mouth, constipation, decreased pulse, low blood pressure, shallow breathing and inability to cough, pinpoint pupils, and malaise. Withdrawal symptoms from opioid substances, tactile reaction, pain, you get a painful, your pain, there's pain everywhere. Psychological reaction, anxiety, depression, or craving, physical excretory reaction, sweating, runny nose, tearing, increased salivation. Digestive tract reaction is diarrhea. Circulatory reaction is hypertension. Respiratory reaction is excessive coughing. Optic reaction, dilated pupils. Muscular reaction, severe hyperreflexes, and muscle cramps. So one of the things you have to do when people are going through withdrawals is to keep them hydrated. Not the easiest thing in the world because they've got fluid running out of their bodies everywhere, out of their body. Yeah. Withdrawal, drug withdrawal is the body's attempt to rebalance itself after cessation of prolonged use of psychoactive substances. Many times for a chronic user, fear of withdrawal is one of the reasons for continued use. Withdrawal often entails muscle aches, pain, insomnia, vomiting, cramps, and on occasion, convulsions. Kinds of withdrawals: non-purposive withdrawal, visible physical signs due to tissue dependence, seizure, sweating, goosebumps, crawling flesh, vomiting, diarrhea, and tremors. Purposive withdrawal, expectation of withdrawal symptoms causing the rationalization of continued use of the psychoactive substance. Withdrawal effects can be observed whether there is tissue dependence or not. Protracted withdrawal, heavy craving for the drug even after the addict has been detoxified. This is usually caused from an external cue that causes the subject to have flashbacks to use and withdrawal symptoms. This often causes a recovery addict to relapse. Post-acute withdrawal symptoms, persistent emotional and physical problems that last from 3 to 6 months after recovery. Unclear thinking and cognitive impairment, memory problems, emotional overreaction, sleep disturbances, motor coordination, dizziness problems, difficulty managing stress, and craving the drug, of course. Sometimes drug abuse is a symptom of other underlying problems. When this is the case, the user will sometimes seek the desired effect by experimenting with drug usage. Replacement will replace the desired drug with another intoxicant. I had a friend who was an alcoholic. He went on the wagon, and by golly, he stayed sober for a really long time. His problem was gambling. He started gambling, and if he had money in his hand, he had to spend it and get rid of it. That guy was broke all the time. Multiple drug use of different drugs or alleviate different symptoms, cycling, using a drug intensely for a period of time, and then abstaining to lower tolerance or allow the body to repair. This is what killed Amy Winehouse. She was cycling. She had been sober for a couple weeks. Then she went on a binge, and she drank the normal amount that she drank before, but of course, she'd been on the wagon, so her body had repaired itself. She had a lower tolerance to the alcohol, and she poisoned herself to death. Stacking, using 2 or more similar drugs at the same time to achieve a specific effect. Mixing, using drug combinations to acquire a new effect. Speedballs are a mixture of cocaine and heroin. This is what killed Chris Farley and John Belushi. Marijuana laced with cocaine, ecstasy and LSD, known as X and L. Methadone and Klonopin, it mimics heroin. Sequentialing, going from one addiction to the other. This can either refer to drug sequentialing, drug replaced by a compulsive behavior, or one compulsive behavior replacing another. And that's what happened with my friend. Morphing, using one drug to counteract another. Cocaine user drinking alcohol to come down. Using coffee to come down off of a drunk. Using methamphetamine to function during a heroin high. Level of use is determined by the amount that you use, the frequency of use, the length of time psychoactive substances have been used, the impact of the drug usage has had on the user's life. Categories of usage include abstinence, experimentation, social recreational use, habituation, abuse, and addiction. Many individuals cannot choose their level of drug use, but are at the mercy of the psychoactive properties of the drug being used. Abstinence means that an individual does not use any psychoactive substances except accidentally. Even if the person has a strong hereditary or environmental susceptibility for compulsive drug use, by never starting, they never get hooked. These individuals might display their compulsive behaviors, other compulsive behaviors such as gambling, overeating, compulsive internet use, or excessive sexual behavior. A lot of times these individuals, I forgot what I was going to say. Oh, compulsive behaviors. When we talk about somebody with an addictive personality, this is really what we're talking about. Somebody that has to do something compulsively. Research shows that individuals who wait until they are 18 years or older to experiment with alcohol, nicotine, or marijuana are less likely to use these substances as gateway drugs for more dangerous substances such as cocaine or heroin. However, if the individual experiments between the ages of 10 and 12, they're more likely to use the early experimentation as a gateway to more serious usage. Individuals who don't start smoking until age 21 are very unlikely to develop an addiction to nicotine. Anyone who doesn't try an addictive substance until age 21 will probably not become addicted. Experimentation with psychoactive substances occurs because of curiosity, but no pattern of usage is developed, and there is no negative consequences from the experimentation unless the usage leads to injury, accident, or illness. The individual has an exaggerated reaction, a pre-existing physical or mental condition is exacerbated, the user is pregnant, the individual is arrested for use, heredity or environment dictates addiction, previous addiction with other substances leads to relapse. Social recreational use, users may seek out a drug for the effect, but no permanent pattern of use is developed. Usage can be controlled for these individuals as long as they do not develop drug-seeking behavior. Habituation, the individual has developed a pattern of usage, but there has been no negative effects on the individual's life. This is referred to as habituation because though there is no increase of usage, the usage pattern indicates that there is a definite craving for the substance. The individual continues to use the substance despite the negative abuse. The individual continues to use the substance despite the negative life consequences that have occurred. These consequences can be personal, problems in social lives, financial, legal, continued use despite arrest for possession, of course, medical, personal health, alcoholic with diabetes, heavy smoker with emphysema, the cocaine user with hypertension, work or school related, emotional stability, LSD user with mental instability. Emotional stability, okay. The difference between abuse and addiction is the compulsive behavior of the addict. The addiction is the classification if the individual has no control over duration of usage or the amount used. The individual has been unsuccessful at control. They spend an inordinate amount of time obtaining drugs or recovering from usage. They limit social, occupational, or recreational activities for use. They continue use despite physical, social, relationship, or psychological problems. They use in the morning for a jump start on the day. They defend their drug usage with anger or even rage. They experience withdrawal when unable to use the drug. They must increase the amount used to obtain the desired effects. Addiction comprises the 4 C's: control, loss of control, compulsive use of the drug, craving the drugs, and continued use of the drugs. The American Psychiatric Association has identified substance use as a mental illness since the printing of their first diagnostic statistical manual of mental disorders in 1952. The current DSM-5 divides substance abuse disorders into 2 general categories: substance-related disorders and some substance addictive disorders. The DSM-5 deals with several drugs which include alcohol, stimulants, cannabis, also known as marijuana, cocaine, hallucinogens, inhalants, opioids, anxiolytics, anti-anxiety drugs, sedatives, hypnotics, caffeine, and tobacco. Hypnotics are sleeping pills. Addictive disease model. This model of addiction sees addiction from the medical point of view. That addiction is a disease. It's chronic, it's progressive, it's relapsing, it's incurable, it's potentially fatal. This model assumes that the addiction is caused from genetic irregularities in brain chemistry and anatomy that are triggered by certain drugs. Research shows that heredity influences drug use and addiction as much as 40 to 60%. The addictive disease model, compulsive drug use with prolonged intoxication with the need to continue use, inability to control use, inability to stop use despite physical, mental, or social problems, repeated attempts to control use, increased intake over time, incurable pathological reactions such as blackouts or dramatic personality changes. Behavioral environmental model. This theory purports that negative environmental factors such as abuse, anger, and peer pressure may cause people to seek, use, and sustain a dependence on substances. This model emphasizes the progressive nature of the 6 levels of drug use: abstinence, experimentation, social recreational use, habituation, abuse, and addiction. The academic model. Addiction occurs when the body adapts to the toxic effects of drugs at the biochemical and cellular levels. Natural balance has been thrown off, causing 4 physiological changes: tolerance, tissue dependence, withdrawal syndrome, and psychological dependence. Diathesis stress model. This model was first developed to explain the causes of schizophrenia. It is a combination of the addictive disease model and the behavioral environmental model. Diathesis means a predisposition or a vulnerability to, and in this case, the individual may have a genetic and environmental predisposition to drug addiction. Stress triggers the drug need, and the stronger the diathesis, the more likely the individual will drift into addiction. Researchers have found that genetics does influence addiction, but that there are over 100 genes that have something to do with drug abuse. Could have something to do with receptors, gene transcription factors, enzymes, neuropeptides, G proteins, or transporters. Looking at twin studies, Goodwin found that of identical twins separated at birth were most likely to choose the addiction or abstinence patterns of their biological parents over their adoptive parents. Similar research found that 61% of the sample maintained nicotine dependence similar to their biological parents, and 55% displayed the same alcohol dependence of their parents. Researchers looking at males in treatment found that children with one alcoholic parent had a 34% greater probability of being an alcoholic than the male children of a non-alcoholic. When both parents were alcoholics, the child had a 400% probability of being an alcoholic. If both parents and a grandfather were alcoholics, the individual had a 900% greater probability of being an alcoholic. 28 million Americans have one parent who is an alcoholic. Researchers have found that 70% of severe alcoholics have a dopamine control gene called DRD2A1. Among social drinkers, only 30% have the gene. When this gene is present, the individual has fewer dopamine receptor sites in the nucleus accumbens. Since many of the missing sites are D2 sites, the individual will need more intense stimulation to feel satisfaction. The DRD2A1 gene seems to indicate the tendency for any problem behavior, as it has been found in other addictive behaviors other than alcoholism. Gambling, ADHD, aberrant sexual behavior, overeating, antisocial personality disorder, and Tourette syndrome, DRD2A1. Some refer to this gene as the compulsivity gene, and the process as a reward deficiency syndrome. People with the DRD2A1 tend to consume large quantities of psychoactive substances before becoming intoxicated, and then have greater dysfunction when they do get drunk, such as blackouts and brownouts. There are also genes that make it less likely that a person will develop an addiction. DRD4 gives the individual an excess of dopamine, which has been shown to play a role in spiritual acceptance, making it less likely that the individual will accept the addictive lifestyle. Environment, interactions with the environment, but especially the home environment, make new nerve cell connections and alter the neurochemistry that the individual was born with, determining if and how the individual will use psychoactive drugs. Factors in the environment: physical, sexual, emotional abuse, stress, love, poverty, living conditions, family relationships, nutritional balance, healthcare, neighborhood safety, school quality, peer pressure, the internet, television. The environment molds the brain's architecture and neurochemistry, determining how the individual will react to outside influences. This is especially true in the first 10 years of life. The brain develops from the front to the back, meaning that the adolescents are more prone to poor impulse control behaviors like substance abuse. Recent research shows that it takes at least 20 years for the brain to become hardwired, and the prefrontal lobe continues to grow until around the 44th year, which means that mine stopped growing about 30 years ago. Memories are established through a network of neurons involving select neurotransmitters, norepinephrine, serotonin, acetylcholine, and dopamine. The more an action is repeated, the more likely the individual will remember it, unless the memory is emotionally intense, in which case the memory has a stronger memory network. Hence the intrusive memories of a traumatic event that may end up causing post-traumatic stress disorder. Children growing up in a chaotic environment where there is excessive emotional pain can deal with the pain in several ways. They can face the pain and try to deal with it. They can find people to help them deal with it. They can accept what happened. They can run away. They can become hyperactive. They can become angry and fight. They can make jokes. They can develop an addictive use: drugs, food, gambling, sex. If the stress continues over time, the counterbalancing behavior will become ingrained in the brain and becomes part of the individual's personality. In the future, when an unwanted emotion arises, they will be drawn to the simplest solution, the counterbalancing behavior. So if the counterbalancing behavior is running away, they'll run away every time they become stressed, or they'll make jokes, or they'll become hyperactive, or they'll get angry and fight, or they'll start consuming fatty foods. The people most likely to abuse drugs: stress is common in the home, abuse of some kind occurs in the home, drugs or drinking are commonly used in the home or among the individual's peers, healthy ways of reacting to stress or anger aren't learned. Society tells the individual that psychoactive substances are normal and an acceptable way to solve life's problems. Living in a community where access to legal and illegal drugs are easy, there are pre-existing mental conditions exacerbated by the negative home environment. Healthy brain chemistry can't be maintained because of poor nutrition. The media inundates the individual with advertisements supporting the use of select psychoactive substances. One belongs to a peer group where excessive use of psychoactive substances is normal. Psychoactive drugs. Heredity in the environment may prime an individual for addictive behavior, but it is a psychoactive substance that they decide to use that will determine the impact of the addiction will have on their life. Excessive drug use will not only make the individual more susceptible to more and more use, but more vulnerable to other stronger drugs. Psychoactive drugs, select psychoactive substances, particularly methamphetamine, cause the death of brain cells through a process known as apoptosis, where the damaged cells are programmed to kill themselves. Psychoactive drugs, nicotine produces an immediate long-term change in the levels of dopamine and norepinephrine, which leads to faster development of tolerance and dependence. Some drugs have a greater power to positively reinforce and therefore compel to a continued use, and that would be cocaine and heroin. Compulsive obsessive behavior mimics drug use, which in turn causes the brain to be rewired. Gambling, eating, shopping, sexual activity, video games, internet use. These are all compulsive behaviors. Research with video game usage has shown that dopamine is released in the reward reinforcement pathway when an individual plays video games, an amount equivalent to methamphetamine usage. Compulsive behavior, PET scans of compulsive eaters has demonstrated that there is a decreased number of dopamine due to receptor sites in the nucleus accumbens. Research shows that between 25 and 60 to 63% of compulsive gamblers have been dependent on alcohol or other drugs in their lives. It has been demonstrated that gambling creates brain disruption similar to drug or alcohol usage. The drug that pushes the individual the hardest and quickest into addiction is smoking nicotine or in tobacco. The drug that pushes the individual second hardest and quickest into addiction is smoking crack cocaine. The drug that pushes the individual the third hardest and quickest into addiction is smoking or injecting heroin. The drug that pushes the individual fourth hardest and quickest into addiction is injecting methamphetamine. The drug that pushes the individual fifth hardest and quickest into addiction is snorting cocaine. The drug that pushes the individual sixth hardest and quickest into addiction is ingesting opioid painkillers. The drug that pushes the individual seventh hardest and quickest into addiction is ingesting any amphetamine. The drug that pushes the individual the eighth hardest and quickest into addiction is ingesting sedative hypnotics. The drug that pushes the individual ninth hardest and quickest into addiction is drinking alcohol. The drug that pushes the individual 10th hardest and quickest into addiction is smoking marijuana. The drug that pushes the individual 11th hardest and quickest into addiction is ingesting PCP. The drug that pushes the individual the 12th hardest and quickest into addiction is ingesting caffeine. The drug that pushes the individual the 13th hardest and quickest into addiction is ingesting MDMA or ecstasy, also known as ecstasy. The drug that pushes the individual 14th hardest and quickest into addiction is ingesting LSD. The drug that pushes the individual the 15th hardest and quickest into addiction is ingesting peyote. And that is the end of the lecture. So, okay. I'll talk to you next